Influenza vaccine. I will be going over the history, the research, injection versus nasal spray, and recommendations of the influenza vaccination. Influenza is a respiratory illness caused by influenza viruses. There are two main types of influenza viruses, A and B, but many different strains of each type. The diseases caused by these viruses are often collectively referred to simply as the flu. Illness from influenza can range from mild to very severe, depending on several factors, including the viral strain, the patient's age, and the patient's health. Certain groups are at higher risk for serious complications from the flu, including adults 65 and older and pregnant women. Symptoms of the flu tend to emerge suddenly and include fever, chills, coughing, sore throat, achiness, headache, and fatigue. Vomiting and diarrhea may also occur, but these symptoms are more common for children than for adults. The word influenza was first used in English in 1703 by J. Hugger of Edinburgh University. The most devastating flu pandemic in recent history was the Spanish flu in 1918 that infected 500 million people worldwide, killing 50 to 100 million of those infected. That's more than the total deaths in World War I. Seasonal flu has between 250,000 and 500,000 deaths every year around the world. Influenza is a serious disease that can lead to hospitalization and sometimes even death. Every flu season is different, and influenza infection can affect people differently. But millions of people get the flu every year. Hundreds of thousands of people are hospitalized, and thousands or tens of thousands of people die from flu-related causes every year. Even healthy people can get very sick from the flu and spread it to others. CDC estimates that flu-related hospitalizations since 2010 ranged from 140,000 to 710,000, while flu-related deaths are estimated to have ranged from 12,000 to 56,000. During flu season, flu viruses circulate at higher levels in the U.S. population. An annual season flu vaccine is the best way to reduce your risk of getting sick with seasonal flu and spreading it to others. When more people get vaccinated against the flu, less flu can spread through that community. CDC recommends use of injectable influenza vaccines during 2017 and 2018. The nasal spray vaccine should not be used during 2017 and 2018. This will also show a 3-component and 4-component flu vaccinations, and down below it does describe for each one and what is recommended for each age group. Recommendations of the flu vaccine are for children. They recommend that everyone except infants under the age of 6 months should receive the seasonal influenza vaccination. They do usually focus special attention on people who are at high risk of serious complications, which you can click on the highlighted red words to get more information. If they catch the flu, such as pregnant women, children over 6 months, the elderly, and the people with chronic illnesses or weakened immune systems, as well as those to whom they are exposed, such as healthcare providers. Don't wait, vaccinate.